At the primary care setting, we have targeted subsidies at Singaporeans who need them more. CHAS enables Singaporeans from lower to middle income households to receive subsidies at participating GPs. In 2018, about 630,000 patients have benefited from reduced out-of-pocket medical expenses due to CHAS and are therefore better able to cope with their bills, especially for chronic conditions such as diabetes. With an aging population, we expect that more Singaporeans will require assistance to help manage their chronic conditions. Primary care, being the foundational bedrock of our healthcare system, plays a critical role in shifting healthcare beyond hospitals and into the community. We want Singaporeans to be able to obtain chronic care in the community and to work with GPs in enabling that. We have therefore reviewed our financing structure to better achieve this with the whole primary care sector and our partner GPs. As mentioned by Prime Minister at the National Day rally last year, we will extend CHAS to cover all Singaporeans with chronic conditions. This is a major philosophical shift, as Singapore has never had universal subsidies for GP care. But we believe this will help Singaporeans as they grow old and also allow for a greater anchoring of chronic care in the community. And as Dr. Lily Neo puts it, to facilitate the seeking of early treatment as far as possible. This new tier, CHAS Green, will soon be available to all Singaporeans who did not previously qualify for CHAS Blue or CHAS Orange. This would consist of households with per capita household income, or PCHI, greater than $1,800. It will provide up to $160 of annual subsidies for chronic conditions. In addition to keeping primary care affordable, CHAS will be another step towards transforming our primary care system to serve Singaporeans. To better support existing CHAS cardholders, as well as managing their chronic conditions, we will also be increasing the annual subsidies for complex chronic conditions for CHAS Blue and Orange cardholders. They will see an increase of up to $20 in their annual subsidies. This means that existing CHAS cardholders can now enjoy up to $500 in annual chronic subsidies. We will also be introducing additional subsidies for CHAS Orange cardholders. They will be able to receive up to $10 in subsidy per visit for common illnesses such as cough and cold at CHAS GP clinics. Collectively, we expect to pay out more than $200 million a year on CHAS subsidies. These changes will take place from 1st November 2019 onwards. We will provide more details closer to that date. To encourage more Singaporeans to tap on the scheme, my ministry is also looking into ways to simplify the application process for CHAS. We are developing an online application which we expect to be ready by September 2019. It will be more convenient for Singaporeans thereafter to apply, and we hope that more Singaporeans can benefit from CHAS. At the same time, as CHAS helps more Singaporeans manage their chronic conditions at CHAS GPs near their home, we will put in the measures to monitor that CHAS clinics are in fact delivering good outcomes. MOH will also be reviewing clinical guidelines for care provided at CHAS dental clinics to ensure that the care delivered is appropriate, relevant, and meets the needs of the patient. Finally, as I have mentioned in this House last month, Dr. Chia Shi Lu will be pleased to know that we will continue to review the PCHI criteria for CHAS and other healthcare subsidy schemes so that the appropriate target group of Singaporeans can continue to benefit from these subsidies.